In this video, we'll discuss lab investigations of dementia. In dementia, thyroid stimulating hormone testing and vitamin B12 testing is done routinely. What about EEG? EEG is useful in Creutzfeldt-Jakob disease and non-convulsive seizure disorders and to evaluate episodic lapses in attention or bizarre behavior disorders like delirium, where it shows slow wave pattern. What's the EEG in CJD? Repetitive bursts of diffuse high voltage sharp waves. Neuroimaging, CT or MRI can identify reversible structural disorders, neoplasm, locate areas of infarction, subdural hematoma, and suggest normal pressure hydrocephalus or diffuse white matter disease. They also show hippocampal atrophy, diffuse cortical atrophy, focal frontal and anterior temporal atrophy suggest frontotemporal dementia. Dementia of Lewy body patients have less atrophy of hippocampus, whereas more atrophy of hippocampus in Alzheimer's disease. Diffusion weight imaging with MRI detects abnormalities in cortical ribbon and basal ganglia in Creutzfeldt-Jakob disease. Large white matter abnormalities correlate with vascular areas. Single-photon emission computed tomography and PET scanning shows temporoparietal hypoperfusion or hypometabolism in Alzheimer's disease and frontotemporal hypoperfusion or hypometabolism in frontotemporal dementia. PET labels amyloid or tau and aid in early diagnosis of Alzheimer's disease, help differentiating Alzheimer's disease from frontotemporal dementia and Lewy body dementia. Lumbar puncture is indicated for CNS infections and it also shows levels of tau proteins and beta 42 amyloid and different pattern with various dementias. Brain biopsy is done to diagnose vasculitis, treatable neoplasm, unusual infection or systemic disorders such as vasculitis or sarcoid.